Welcome to EasyTreatment Healthcare Private Limited, your bridge to global healthcare. At EasyTreatment, our mission is to be your preferred healthcare partner, providing personalized and comprehensive medical assistance to patients worldwide. Our vision is to be a global leader in medical tourism, known for our commitment to quality, compassion, and excellence in patient care. At EasyTreatment, we cater to all patients, ensuring a seamless healthcare journey regardless of your location or background. Start with a simple inquiry. Contact. Visit our website for an initial consultation, where we'll understand your medical needs, preferences, and budget. We conduct a thorough assessment of your condition, discuss available options, and assist in scheduling appointments with top-notch healthcare providers in Hyderabad. Our dedicated team will accompany you to hospital visits, ensuring smooth communication with healthcare professionals. We provide continuous support throughout your treatment, from follow-ups to medication assistance. Even after your treatment, we're with you every step of the way. From post-treatment care to coordination of follow-up appointments, we've got you covered. Our comprehensive services include medical tourism, free medical assistance, appointment scheduling, medication and investigation support, second opinion services, and budget-friendly hospital selection. Our exclusive services includes organ transplant, joint replacement, robotic surgeries, neurosurgeries, heart and cancer treatments. For our NRI patients with parents in India, we go the extra mile. We support in carrying them to the hospital and ensure their safe return home. We welcome your loved ones with open arms, offering arrival support, airport transfers, and initial orientation. Experience hassle-free healthcare with EasyTreatment Healthcare Private Limited. Your journey to wellness begins with us. Contact us today at.
Good afternoon all. My name is Karishma. I welcome you on behalf of EasyTreatment Healthcare. Today we are hosting a webinar on Conquer Cancer Together in the EasyTreatment AskTheDoc webinar series. I would again like to welcome everyone who is present today. EasyTreatment is a medical assistance organization committed to helping people with any kind of health problems. We seek to provide a clear understanding of health problems, answer questions, provide quick access to doctor support, and manage your treatment from start to finish and post-treatment. We extend a warm welcome to Dr. Garima Sarawgi, a two-time University Gold Medalist and the only female MCH Surgical Oncologist in Eastern India. With over a decade of experience, Dr. Garima specializes in breast, gynecological, gastrointestinal, head and neck, uro, bone, and soft tissue oncology. Her patient-centered approach and dedication to cancer care are unmatched. We have another speaker, Dr. Shiva Prasad. Dr. Shiva Prasad is a consultant radiation oncologist at Yashoda Hospital, Secunderabad, specializes in high-precision radiotherapy methods including IMRT, IGRT, SRS, and SBRT. With a master's in radiation oncology from KMC Manipal, he brings extensive expertise in advanced cancer treatment and patient care. We are honored to have them present this webinar. After the presentation, there will be an opportunity for all of you can ask questions. So please feel free to ask your question in Hindi, English, or your local language also. Both of the doctor will provide you clear, helpful answer, making this an invaluable opportunity to learn from the top oncology experts. So please, doctor, you continue further.
Good morning. Thank you, EasyTreatment, for this brilliant opportunity to make our own community aware about the disease which we are passionate about. Today's conference, as already mentioned by Karishma, is about knowledge of cancer and how we can help the local community. I hope using the English language as a medium of conversation is comfortable for everybody. So the objectives will be cancer. We will explain you what is cancer, how big the problem is in India, important causes of cancer. Amongst them, the preventable causes will more focus about, like alcohol, tobacco, stress, and obesity. Important signs and symptoms of cancer will also be discussed. Lifestyle modification and how can we prevent cancer happening in people. Treatment options, and then we will have a question and answer session as already mentioned. Next slide, please. What does the word cancer mean to you? So all the participants can message in the chat box. What does the word cancer mean to you? Cancer. Next slide. Most of the people feel cancer is a stigma. It is a terrifying illness. The word cancer, the moment a doctor breaks the news of patient having any kind of cancer, they are actually genuinely terrified. They think that cancer will kill. Next slide, please. It is a terminal illness. They think once the cancer is there, they will not be cured. They will die of the disease. Next slide, please. So I will tell you what actually is cancer. Normally, all the cells in the human body divides at a genuine, normal, gradual rate. So the cells will grow, they will divide in a fashion, and they will die in an orderly fashion. Like our hair, nail, which we all can see, grows. Similar to hair and nail, all the other cells of the body also keep on growing. But if there is no natural process of death of the old cells or the senescent cells, which are not functioning normally, then there will be continuous growth of the hair, right? So there is a term called apoptosis in which the body's normal mechanism usually makes the cells divide in an orderly fashion, so that the number of cells being born new are almost equivalent to the number of cells that die. Next slide, please. But cancer is a psychopath. So in cancer, what happens? There are multiple triggering factors that we will be discussing with you that causes the cells in the body not to die in the way they are supposed to die. They just continue to grow by dividing themselves in a disorderly manner, in not a proper manner. And the worst part about cancer cells is it usually disrupts the normal place where the cells are dividing. Because if they are not orderly cells, they will also change the local microenvironment of the organ or the place where the cells are dividing. Next slide, please. So when there is unregulated growth of cells, which is not normal in the body, it forms a mass. This mass is nothing but cancer. Next, now I'm talking about the reasons which are preventable causes for cancer prevention. First and foremost, I will like to talk about tobacco uses. Tobacco causes cancer throughout the body. So the 4 things that I elaborated in the discussion part were tobacco, alcohol, stress, and obesity. These 4 things are currently the reasons which are totally preventable and which causes a cumulative of more than 70% of the cancers in a human body. You all must be knowing the incidence of cancer has increased vastly in the past few decades. So there is a lot of reason to that. More so are the preventable reasons, the usage of tobacco, the trends of usage of tobacco and alcohol throughout the nations. India is also adapting the westernized culture. So the dietary factors, the modifiable factors that we can actually control. Also the factors like westernization is leading to obesity and more stress. So these are the 4 major factors which each and everybody present here can actually prevent and help themselves to not harbor cancer in the body. First, I will talk about tobacco. As shown clearly in the slide, tobacco causes cancer throughout the body, not only mouth, or lung as normally thought by people. So when we start from the top, mouth, throat, the voice box are the first three things, out of which more than 80% of the cancers are only and only because of tobacco. Next, coming to the esophagus. Esophagus is the food pipe. Kindly go to the previous slide. No, this one, yes, please stay here. Esophagus. So, esophagus is the food pipe where also cancer can happen because of tobacco usage, especially the upper part of esophagus. When we go to the windpipe, below the voice box, we have the trachea. The bronchus are the lowermost part of the windpipe, and then comes the lungs. So, all the part of the windpipe, because of the inhaled smokes, it goes and causes lung cancer. When we come to the lower part in the abdomen, liver, stomach, pancreas, colon, and rectum. Colon and rectum are the parts of large intestine. Pancreas, we all know that it is an organ that helps in secretion of enzymes, that helps in digestion. Also, it controls the insulin levels in the body. When we are going to the urinary system, kidneys and the renal pelvis is the part of kidney that collects the urine. So the part of kidney also can harbor cancer because of tobacco usage. In females, the uterus, the ovaries also, which is not mentioned here, and the lower part of the uterus, which is called cervix. The cancer in these parts are known to be associated very closely with tobacco usage. When we come down to the pelvis, the urinary bladder, which is a pouch, we call it the urinary pouch, that is also affected because of cancer, by cancer in tobacco, and also the rectum, that is the lowermost part of the intestine from which we deload our feces. Next slide, please. Coming to alcohol, alcohol causes, over here 7 types of cancer are mentioned. Nevertheless, alcohol causes a lot of more cancers. Also, not only individual alcohol is causing cancer, but the usage of alcohol is usually seen in conjunction with the usage of tobacco. So people in the parties, in the normal households, they consume alcohol. They also consume cigarettes or vapes or e-cigarettes or gutka, form of tobacco, along with alcohol. So usage of alcohol has a synergistic effect in increasing the chance of having cancer multiple folds when used alone. So the types of cancer that can be caused usually by alcohol are again mouth, upper throat, larynx, the food pipe, esophagus. Breast in women is very important. Breast cancer is also related to usage of tobacco. In the recent studies, it has been shown. Liver cancer, a large proportion of bowel cancer is also because of alcohol consumption. Also, there is an indirect relation between the usage of alcohol and the pancreatic cancer. Next slide, please. Yeah, so sorry for the interruption. So the 10 types of cancer that could be caused by obesity or weight gain. So yes, westernization is leading to more and more obesity in the population. The current lifestyle is leading to more and more people who are having obesity, and obesity is directly related to these all types of cancers mentioned here. I will name them so that we understand clearly. Once we adopt an unhealthy lifestyle, that will eventually lead to cancer. This obesity is completely under our control, and we can have a healthier lifestyle to reduce obesity. I'm one of the people who is going to adapt to that sooner. The types of cancer caused by obesity are esophageal cancer, the food pipe, breast cancer. Breast cancer in obese women is directly correlated after menopause, that is after your period stops. Nevertheless, obesity and breast cancer is also related in people before menopause, during the reproductive age. Gallbladder cancer, liver cancer, pancreatic cancer, kidney cancer. Bowel means intestinal cancers, and the uterine cancers are directly related to obesity. In the uterine cancer, there is the innermost layer of uterus is called endometrium. So endometrial cancers have shown to be linked to obesity by 50%. Next slide, please. So as I was talking about urbanization, unhealthy lifestyle, and the diets that we are adapting, which is leading to carcinogenesis. That means formation of cancer cells in the body. Unhealthy diet that could increase the risk of cancers. Already mentioned earlier, mouth, upper throat, larynx, lungs, stomach, bowel, even the other organs like pancreas, urinary bladder, and the uterus. So how can we actually prevent it? Over here, if you can see in the slide, there are two things mentioned. Let's beat cancer sooner. That can be done immediately by improving our diet. We have to eat more of vegetables and fruits, fresh fruits and vegetables, and a high fiber in the food. And by reducing processed meat, the red meat, tinned and canned junk food, and the high calorie food can help us reduce the incidence of cancer in our own population. Next slide, please. So this is just a random question. Anybody who can answer will get a personalized gift from my side. Can anybody answer the number of chemicals and carcinogens in the tobacco smoke? Carcinogen means the chemicals that are shown directly to cause cancer. So out of the 4 options, options A, B, C, and D, E, 5 options. If anybody can tell in the chat box or raise a hand to answer. So Mr. Kaustav Mishra has answered E. Mayuri Navya, D. Hima has raised the answer. Can you please put your answer in the chat box? Sahita has answered D. Diksha has answered E. Anybody else? Hima, you can answer here. Komodi has answered E. I'll wait for another 30 seconds. I want more and more people to participate. Pulaman Mamidi has answered E. Yeah. Hima Nikhil has answered E. Amravati has D. Hima has answered D. Yeah. So first mentioned by Mr. Kaustav Mishra and then subsequently by multiple people, the correct answer is actually E. To our surprise, the number of chemicals in tobacco are more than 7,000. So there was a study done in USA on the cigarette packets that are available exclusively in USA. Similar to those composition are what ITC company produces over here in India as well. So the number of chemicals are more than 7,000, not just 7,000. They are much more. Out of which direct carcinogens means the chemicals which directly causes cancer and leads to the process of cancer cell formation are 70. And apart from these 70, when we have examined Indian cigarettes, there is a study by Tata Memorial Hospital at Mumbai, which was published in the year 2000, that has shown there are 269 carcinogens in the cigarette packets which are available in India. 269 chemicals that directly causes cancer. Can you believe it? Also, a study showed by the same Tata Memorial paper has revealed that there are more than 372 chemicals that causes cancer in the BD packets and in the low quality cigarettes. Next slide, please. So how tobacco smoke causes disease? This is a report by journals. It was published in Health and Services in 1798 by US Department of Health and Human Services. So we are talking here about 1798 when in the US, first association of tobacco and cancer was completely, directly, scientifically established. Next slide, please. So this is a paper I was talking about. The list of additives in cigarette, if we can see the last line mentioned in the slide, shows more than 7,000 chemicals of tobacco smoke and more than 250 known to be harmful, out of which 69 can cause cancer. That is carcinogen. So I would request the organizing team of EasyTreatment To give the gift to the first correct answer, Mr. Kaustav Mishra. Next slide, please. These are the named carcinogens. The names of the chemicals which are isolated from cigarette are delineated here. So as normal layman, we need not remember the names of all these chemicals. We just need to see that there are so many chemicals which are actually disrupting the normal division and death of cells in the body. They are causing abnormal division of the cell, which is leading to cancer formation. Next slide, please. So now we'll talk about the prevention of cancer. The next few slides, I have already spoken about the modification of diet, how it can directly attribute to prevention. Now, smoke is one of the major causes that is causing tobacco, is one of the major causes that is causing cancer in India. To our astonishment, I will let you know a fact. India has been declared as the global capital for oral cancer. So in India, the world's highest number of mouth cancer are diagnosed and treated every year. When compared to the entire world, India contributes to more than 40% of oral cancer patients alone. So that is why India has been unproudly named to be the global capital of oral cancer. Why? Because India, we have a special form of tobacco consumption in the form of gutkas. So there are multiple chewable tobacco, which in the form of gutka, pan parag, rajnigandha, multiple zardas, in the form of kheni, and multiple other mixed products that people keep it in the mouth for a long term for temporary gratification. This is about smokeless tobacco. We call the chewable tobaccos as smokeless tobacco. So now smoking tobacco, we all know about cigarettes. They are age bound, long lasting. People are using it since ages, and people earlier used to feel it to be a statement of their high class or their the youngsters now are switching to the newer forms of cigarettes that are called e-cigarettes. E-cigarettes are nothing but they are battery operated small containers which have tobacco liquid which vaporizes. The youngsters are also too much into shisha, hookah nowadays. All the school going students also are a lot more interested in usage of shisha. So these, I will show you the example of e-cigarette that I have procured to show you. So this is one of the examples of an e-cigarette. It is available in small electrical vape and pods. Youngsters are attracted by it. There are multiple flavors that is added to this e-cigarettes and people smoke it. So the flavors are in different mint flavor or rice flavor. Even the cigarettes are available in different flavors nowadays. So these help in attracting the younger generation to the usage of the tobacco product. Now, not all the young people know that these much of tobacco, the e-cigarettes and vapes and the hookah contains tobacco also. They are aware that most of them only have the flavors. But because of the flavor, the inhalation is smoother. It is deeper. It goes to the deepest most part of the lung. Having said that, vape and e-cigarettes are also a lot more dangerous because they use the electronic medium for the disbursement of the vape or smoke to the deepest part of the lung. Vape word comes from vapor. That is the liquefied tobacco mixed with the flavors, vaporizes and goes in the form of liquid, in the smoked liquid form. So the absorption inside the lungs are much more higher than the absorption of a dry smoke. Yes, Mr. Prakash, I will be answering your questions in the question answer session. So my first take home message for the day is for everybody who is here, kindly let all the youngsters know around you to be smart and do not start. Be smart and do not start is the first mantra we can give to all the young generations in our knowledge, so that they do not start these kinds of things that leads to tobacco consumption and damage to their body, which they are inducing themselves. So being smoke free is one of the ideas that we can all adapt when there is a cumulative effort of the entire community and every level of the community. Smoke free can prevent 15 types of cancers as mentioned in the slides. These are the same cancers that were elaborated earlier. Next slide, please. So as I was mentioning earlier, alcohol and cancer risk. Here in this slide, we are mentioning about the percentage of cancer that increases on consumption of alcohol. So respected and dear members who have joined the elite session today, I need you to mention this very specifically, that when I'm talking 1 point something percentage, that does not mean only 1.8, because normal human body without doing anything, many people who do not consume alcohol, who does not consume alcohol, who do not smoke, also get cancer, correct? So normal human body also has different various mechanisms in which cancer may come to the body. But when we are consuming alcohol, we are increasing the risk in a normal human body to a different proportion. And the mentioned statistics in this particular slide has been taken from specific studies, scientific research articles which have been established. So in head and neck cancer includes everything from year to year. Most common cancers to occur, as already mentioned, are oral cancer, throat cancer, the inside of the mouth, the pharyngeal cancers, and also the neck cancers, all the parts of the neck, upper part of the food pipe, upper part of the windpipe. The cancer risk increases from 1.8 to 5 times in head and neck. In esophagus, that is the windpipe, and that is the food pipe, it increases up to 5 times again. Liver cancer is twice. Breast cancer, over here it is mentioned 1.6 times. But a recent most article published in the Europe in 2023 has established the risk of breast cancer and alcohol consumption to be 2.7 times. Colorectal means intestinal cancers are 1.5 times. So here one interesting thing is mentioned. A light drinker is less than 1 drink per day. Moderate drinker is 1 drink per day in women and 2 drinks per day in men. So I want to highlight this point. This is a standard definition by the US. WHO has also accepted this definition of drinking capacity in people. Up to 2020, it was established in a study. Moderate drinker in women, in females, is 1 drink per day. Here 1 drink means 60 ml of a drink which contains less than 40% of alcohol. But 2 drinks in a man. So by nature, woman body, female body is such that any harm induced in the female body by ourselves will cause much more harm when compared to a male body. The delicacy of the female body is such that the harmful effects are also much higher in the woman body. Heavy drinker are 4 drinks per day or 8 drinks per week in women also is a heavy drinker. 5 drinks per day or 15 drinks per week in men. Binge drinker is more than 4 drinks for women and more than 5 drinks for men in a single sitting. So most of the people who go to parties, they have a different lavish lifestyle, usually comes under the category of binge drinking. One interesting fact I will focus here is binge drinkers are likely to harbor more percentage of cancer by 0.7% of each variety of these cancers mentioned in the slide if they do binge drinking more than once a month for 1 year. So just in 1 year, by binge drinking, a person is increasing their cancer risk by another 0.7% extra to what it would have been normal if the amount of consumption of alcohol would be lesser in the same setting. Next slide, please. Can you spot the difference? So I want again 30 seconds somebody to answer. On the left hand side of the screen is a small vehicle. In the right hand side is a larger vehicle. So we call what kind of vehicle? Yeah, the size is difference, right? So this is a lightweight vehicle. It's a heavyweight vehicle. We can see in all the toll gates mentioned. So why this interesting slide has been put now? To make you remember this slide and understand a heavyweight vehicle. Next slide, please. Is equivalent to an obese person. And obesity, as already mentioned to all of you, has a direct link to cancer. Obesity is in its way to replacing tobacco as the #1 preventable cause of cancer. We need to confront this growing problem and develop all the necessary tools to limit its impact. This was mentioned by Dr. Clifford Hughes in the ASCO presentation in 2013. In the ASCO is American Society of Clinical Oncology. That is the largest society in the world, which actually does most of the research work for cancer. And the president then had mentioned that the kind of lifestyle people are having, people are all the human beings are going towards more and more urbanization. We are leaving our own Indian root and culture, going towards westernization and doing nothing but attracting diseases because of that. So the cancer risk in men and women are separately mentioned. All these I have already elaborated in the previous slides, which are directly linked to obesity. In 2007, this is a study whose summary is given here. More than 84,000 new cancer cases were directly attributed to obesity, 40% of which would have been prevented if cancer was not there, and 40% of which was in esophagus in men and endometrium, that is the innermost lining of the uterus in females. So scientifically proven mechanisms that links obesity to cancer are mentioned here. Obese people often have increased level of insulin. So there is a factor called IGF. Now I'm talking just 2 lines about the scientific reason so that you understand there are chemicals which is released in an obese body, which is directly related to the development of certain tumors and cancers. So number 1 is insulin-like growth factor. It's a chemical, directly causes abnormal proliferation of cells and hence cancer development. Number 2, chronic means a long-term sustained inflammation. Subacute means less than very high inflammation. Is persistent in anybody who is obese. This is aggravated when smoking is there or tobacco usage is there and alcohol consumption is there. This chronic inflammation is a triggering factor for the cancer cells to divide uncontrollably. Number 3, they produce higher amount of estrogen, the obesity cells, the fat cells, both in males and females. So the males, if I'll explain this very quickly. Males, the obese males usually have gynecomastia, means enlarged breasts, if you have noticed. That is why, because the fat cells have chemicals, they generate chemicals that will convert the male hormones to female hormones. The amount of estrogen developed in such males is high, that increases the proliferation of the breast cells as well. So this typical example shows very, very clearly that all the types of cancers like breast cancer, like prostate cancer in males, like endometrial cancer, even pancreatic cancer and stomach cancer have direct correlation with estrogen receptors. So when estrogen levels in the body are high in obese people, the propensity of having these cancers is also high. And the last thing, the fat cells also have effects on certain tumor growth regulators. As I mentioned, multiple chemicals are released in the body, which helps the cancer cells to grow and checks its controlled death. Next slide, please. So this is a classification of obesity. I will just want to mention one thing. This chart is available everywhere in the everywhere in Google or internet, and all of you are accessible to internet since you are doing webinar. So kindly check what is your own BMI, check in what category of obesity you fall, and then start correcting it immediately. So in this chart, there are six categories: underweight, normal range, overweight, at risk, obese class 1 and 2. So obese class 2, that is a BMI of more than 30 with severe obesity, do not only have increased risk of cancer, but because of that, they have increased risk of multiple other diseases as well. Similar to what happens in tobacco. Tobacco does not only cause cancer, but tobacco causes multiple lines of non-communicable diseases as well. Non-communicable diseases are most commonly heart diseases and lung diseases, like chronic obstructive pulmonary disease, people with bronchial emphysema, people with chronic COPDs, we call them, for lungs. In heart and in brain, multiple vascular infarcts may happen. In layman language, we call them stroke. That is CVA, the coagulation of artery. Yes. So I would like to emphasize here is that obese class 2, heavy consumption of tobacco, heavy consumption of alcohol, and a bad lifestyle, which are all preventable by us, does not only cause cancer, but they lead to so many more number of diseases in the body that the immunity is screwed up. The immunity is actually not, body's self-defense mechanism goes very low. And in natural, normal process, the body's defense mechanism would have tried to counter these diseases. But because the immunity becomes so low, that body cannot resist to the diseases and ultimately succumbs to it. Next slide, please. So this is an interesting slide put by EasyTreatment. Top 5 causes of breast cancer on career women. Yes, even me, I'm a career woman. And approximately 30% of women now in India are career women. Everybody does work. And we will be astonished that in the rural population, 70% of people, women are working to earn their livelihoods. So even they are career women. When we are mentioning about career women here, we are mentioning about women who are not having a relaxed lifestyle, who are stressed, and who choose to have an urbanized lifestyle. Because any urban or city lifestyle on a woman is more taxing than on a man. There is no offense to all the men here. Whichever is a career woman or able to pursue their own dreams is probably by the support of men around them, of course. But a given fact is, women body itself is made in such a way that the taxing on the body is much higher. And this slide clearly shows that. This is also after a study, and it was mentioned that career women have 70% high risk of developing breast cancer than housewives or women in low status jobs. This was by Dr. Titania, who had put this in the breast cancer study, occupation study in the publication. So not that you should stop pursuing your career, but even if you're a career woman, start prioritizing yourself. Look after yourself so that you are able to look after your job and your house both. Next slide, please. This is an interesting slide again. So I will just want you to see the right top corner. Did you believe stress contributes to the diagnosis? So 54% of population told yes, the stress that something may happen to, the stress in a person, which is a very long-term stress because of their work, lifestyle, multiple other factors. People have mentioned in the studies that 54% people have mentioned that leads to the diagnosis as well, because they are stressed of multiple other things. They do not get diagnosed earlier. They get diagnosed later stage of the disease. That is one thing which I wanted to highlight. And all the kinds of stress is mentioned here: work stress, relationship and family, body issues, mental issues and trauma, financial issues. Financial issues is taking a toll, although people in the study have not agreed to it, but a lot of people are only after money. So what happens is, when you are too ambitious, it is good, but the ambitions with stress causes all the factors that is caused by alcohol, tobacco, by obesity, a chronic subdued inflammation in the body, which raises the hormones, which alters the metabolism of the body, which stimulates the cancer producing cell activity in the body, which increases the division of the blood vessels so that the cancer cells are more fed with blood and nutrition, which damages the basic DNA of the cells, which increases mutations in the genes throughout our life, which alters the genes that cannot control the stress response, resulting in changes at the genetic level causing cancer. So stress definitely has proven to increase the risk of cancer. Next slide, please. Yeah. So women are more affected by stress-induced sleep problems than men, 89% and 84% respectively. So 5% increase in insomnia because of stress in women is shown in the study. There is a sub-analysis of this study which mentions that this 5% increase causes 20% increase in the side effects of insomnia in females. So sleep problems caused by stress or anxiety is in 88% of people. Next cycle, please. So as I was mentioning about stress, the study done across the world, Millennial Careers 2022 Vision, has shown that across the world throughout, India is the country which has average working hours per week as 52 hours, which is a punishable crime in Western countries. And the other countries, neighboring countries like Singapore, China, Mexico has 48 hours on an average. Switzerland, Greece has 47 hours. On an average, the other countries' working hours per week are less than 45 hours. Somebody is mentioning slides are not visible on the screen. Could the organizing committee please recheck? I'm able to see my screen though. So in India, there is a lot of manpower, but also there is exploitation of manpower. So second take-home message today from my side is work hard. Work definitely hard. But please understand, stress because of work is not worth it. So my second take-home message is this. Next slide, please. Yeah, so when people smoke, there is a smoke generation, a lot of industrial pollution, a lot of pollution by the automobiles is there. So the invisible killer is air pollution. It may not be always visible like in Gurgaon, but 36% of deaths from lung cancer, 34% of deaths from stroke, and 27% of deaths from heart disease is attributed to the invisible killer, which is air pollution. So the World Health Organization created Clean Air, Healthy Future, Breathe Life campaign for the same climate clean air coalition. Next, please. Yes, so our dear Dr. Shiva Prasad is also here. Shiva sir.
Yes, sir. Yes, ma'am.
Sir, I would like you to tell the people here about the warning signs of cancer. So if you can take up this slide and explain in a couple of minutes.
One second.
So Shiva sir, you can
Yeah,
just
yeah.
tell basic warning
Can
signs, whatever you feel like.
Yeah. So you very beautifully explained. Very good morning to everyone. I think it's been a very exhaustive session for most of the people here. And I believe such a exhaustive lecture and such a beautiful lecture is very lucid and easy to understand lecture. I think it has helped quite a lot of people here. But I think lastly to end with, I know I would like to just stress upon the warning signs for the cancers. You should be aware of. This the warning signs doesn't necessarily mean that these have to be cancerous, but you should definitely raise a concern that there could be a possibility, but you have to get evaluated by a specialist for these kind of symptoms. Firstly, with a persistent headache, and you need to which is not going away with your regular medicines, and despite where your repeated checkups. I think that's one. And second, shortness of breath and cough. So shortness of breath and cough could also be a symptom or a manifestation of lung cancer. And so it's again very often associated with your bloody cough, where the person starts coughing up blood. That happens quite in a advanced stage. And especially if it's associated with symptoms like decrease in appetite, or also weight is very severe weight loss. And next, coming to the indigestion and difficulty in swallowing. So it could be associated with various number of cancers, like throat cancers, and also cancers of your esophagus, which is also commonly called as food pipe. And so these kind of cancers, what they usually obstruct your passage of food in your throat and also your food pipe. And next, coming to loss of appetite, it could be a general symptom. It could be associated with most of the cancers in advanced stages, wherein person begins to eat less and less. And you definitely have to raise an alarm regarding the probability of cancer. And next, coming to the sore throat and or a bruise that doesn't heal, especially in case of oral cavity cancers, where you have an ulcer despite taking all the medications and applying all sorts of ointments, and despite seeing your dentist or ENT surgeon, that's not going away. I think you need to get evaluated by oncologist by getting a small test called as biopsy, which is basically a small sample is taken. Excuse me. A small sample is taken from your ulcer and then sent for the testing to rule out the presence of cancer. And then a change in bowel or bladder habits, all of a sudden, especially if you see some sort of obstruction, if especially in elderly people, and for the people, and you see some blood in the stools, or you see blood in the urine, and especially in elderly people. So I think it should definitely go to see your urologist, and I think to rule out probability of your intestinal cancer, which is the lower part of the intestine, as Madam suggested earlier, alluded to earlier as a rectum. Then if you have cancers like if there is any unexplained changes to your fingernails or blood in urine, also again the stool in the or the spit. Like I said earlier, it could be associated with cancers of your urinary tract, like kidneys or your urinary bladder, and also if you have blood, if you happen to see any streak of blood in your stools, you could have cancers like colon, and also rectum, like I told earlier, and also when it's especially when it's associated with obstructions of your loose stools. And lastly, I think if you have any happen to see mole anywhere on your body, which is progressively increasing in size and also shape, and if it's bleeding, especially and and it's which happens over a quick period of time. By quick, I mean a few weeks to few months. So you definitely have to bring it to the attention of your dermatologist or your doctor or a surgeon. So to rule out any kind of skin cancer. And again, any kind of lump in the breast, or even which is swelling in anywhere across your body, which is constantly growing in size, and that's not going, that's not, and especially if it's a breast lump that's actually bleeding, and if you have any lump in the neck or in your armpits or in your groin, so which is not going away, and it's progressively increasing in size, that should also I think it's important to bring it to your attention of your physician or your doctor or surgeon. And then if you have any kinds of growth in the skin or a ulcer, on your face or anywhere across your body, I think you need to see your doctor immediately, which is to get a simple test called biopsy. Next, can you move to the next slide? So the next question, as ma'am has already suggested, the various things, various risk factors that could actually lead to cancer in. One important aspect I would like to focus on is the prevention of cancer in a lifetime. Yes, I would definitely say there are important the risk factors, like Madam has elaborately explained to you, such as smoking and alcohol or tobacco, betel nut. I think there were a few questions in the chat box as well regarding the risk of this thing, and also the obesity. So all this and also avoiding the air pollution. So these things are definitely a modifiable risk factors, I would say, which definitely can be cut down and totally avoided, which would go a long way in preventing the cancer. And then again, when it comes to the vaccinations, especially with the cancers like cervical cancers or renal cancers or oropharyngeal cancer, you have vaccines available which can totally, which can be preventable by even. I think now you have vaccines which are available at a very cost-effective rates as well in India now. I would recommend all the females in the group to take to get yourself a vaccine, especially the HPV vaccine, which could be taken till the period of 45, and also and I would recommend that the earlier is better. Because you would require only just the 2 doses. Beyond 14 years, what the recommendation is to take 3 doses of this cervical cancer vaccine, which is called as Gardasil, commonly available everywhere around. And also, lastly, coming to the screening of cancers. So screening, most commonly, where the screening is nothing but you try to catch the cancer, catch the cancer in the early stages of this development. So this is commonly employed in cancers like breast cancer, cervical cancers, and oral cavity cancer, where you can simple breast examination or self breast examination could go a long way. And if you happen to notice any lump in the breast, so you should bring it to the notice of the surgeon. And also any the cervical cancer, a simple test called pap smear or human papilloma virus test.
Yes, sir. I think Shiva sir's network is fluctuating. So I will continue here, will not wait. Let sir join back. 2 things that sir mentioned is signs and symptoms. Yeah, Shiva sir is joined back. Sir, I think you were out of network.
Yeah,
Yes.
sorry.
No problem.
So the breast cancer, I was talking about a simple breast examination and a mammogram would help you, especially if you're age 40 and above. It's high. It would it would definitely help you to detect the cancer early, especially for if you have any family history of breast cancer. It's highly recommended to get a digital mammogram, and if you carry a familial risk or any history of any of breast cancers in your family or ovarian cancer in the family, in case you have syndromes like BRCA, which is I'm not sure if you've heard about the BRCA mutation, which is associated with breast cancer, and which is actually attributable to quite a number of breast cancer these days. I think in those kind of cases, the recommendation is to get an MRI, breast MRI, especially if there is a strong family history. And lastly, I think oral cavity cancers, you have to see a dental surgeon, especially if you have a history of achieving betel nut and betel quid, and also tobacco smoking or alcohol. So I think you need to get examined by a dentist. And also, lastly, I think if you have elderly people, you should also go to get a small coloscopy test, which is actually to rule out colonic cancers, especially in elderly people at your home. And so the screening procedures, all these screening procedures I just mentioned, it will have a major impact in reducing the chance of death from these cancer by detecting early and intervening early at early stages. And lastly, I would can you move on to the next slide? So I would like to stress on the fact there's no better treatment than prevention. I mean, so I think all these lifestyle modifications and vaccinations and screening programs would help a long way in reducing the cancer burden in our country. And if you have any specific questions with regards to the cancers or any specific doubts, I think you can always reach out to me. I'm available at the Yashoda Hospitals in Secunderabad, that's in Hyderabad. I'm sure lots of people in the group know about the hospital. So, I would be happy to help you people. Thank you. Thank you so much.
Thank you so much, Shiva sir. Yeah, I will continue. We will not discuss too much about the scientific things now. Sir very nicely elaborated about the signs and symptoms of cancers and how we can prevent them. So this is a slide. I will just consolidate and tell my third take-home message. So remember, the abnormal things, normally body has a mechanism in which we can always, the body itself will try to prevent and overcome any disease, anything that comes with or without medication many a times. Something which is not getting cured by itself sooner, becoming a chronic, long-term, anything in the body may become cancer. Just remember this. Any lump which is not there, any oral lesion which is there, not curing by vitamins, by other means, may cause cancer. Number two, any lump, any abnormal bleeding from any part, any orifice of the body, like mouth, like nose, like ear, vagina in females, urinary tract or stool. Any abnormal bleeding, menstrual bleeding is a normal bleeding, so I'm talking about abnormal bleeding, may harbor cancer. Not that it is cancer. In 80% of the people, these things are not because of cancer. The problem is, as Dr. Shiva very clearly mentioned, we can prevent all the deaths because of cancer. So my third take-home message is, cancer does not kill. Late diagnosis kills. So delay in the diagnosis is from the patient perspective because they do not come to the specialist to show. Also doctor perspective, because the specialists who are not cancer specialists would definitely delay the diagnosis. So my third take-home message is, cancer does not kill. The delay in diagnosis kills. So one humble request is, the 3 preventable major activities that all of us can start from today. Number one is oral self-examination. Number 2 is breast self-examination for all the females, as Dr. Shiva mentioned. Number 3 is vaccination. So if these 3 things are also done, by all the members in today's conference. I'm sure if also they get the disease in any point of their time, themselves or their relatives or friends or family, the diagnosis will be much earlier. When the diagnosis is earlier, we can prevent the death. The 12 ways to reduce the cancer are, we have already spoken about smoke, healthy lifestyle and weight, physically being active, having a healthy diet, avoiding alcohol, avoiding too much of sun for skin cancers. This is more for the Western population. Pollutants, radiation. For women, a self-breast examination is important. Hormone therapy that women take after their menopause for their symptoms also have additive effects. Every female above the age of 9 years up to the age of 25 years or before starting their sexual activity is recommended to get the HPV, human papilloma virus vaccine. This vaccine is available now by the Serum Institute of India in a very, very cost-effective manner across India. So it is recommended that please get your wives, daughters, your children, your nephews, all the women vaccinated against cervical cancer. HPV can prevent 98% of cervical cancer that happens. And get screened for cancer is the last way to reduce. In the high-risk population, the recommendations are different. In the developed countries, the government is spending a lot of money for screening the population, which is mandatory screening and free of cost by the government. India is a developing country and is going towards being developed. We do not have any screening protocol per se, but the screening that is recommended in the developed countries can be adapted by individual people. So I'm sure all the people here, all the women here, all the males here have enough money that they can get at least a single test done per year. So all the men above the age of 60, all the women above the age of 40 get at least, for males, a serum PSA, prostate specific antigen, done. And for females, get one digital mammogram of bilateral breast done. This is my humble request and my fourth take-home message for all the members today. And this is definitely going to help in early detection and complete prevention of the death because of cancer. Next slide, please. So in the following slides, we are going to quickly summarize Dadi Ma ke nuskhe, the things that were told by our elderly, our ancestors. Usage of turmeric a lot in the food. It is a typical Indian spice which has a very powerful anti-cancer properties. Now the turmeric is available, the essence of turmeric in many tablet forms for cancer patients. Vitamin C kills the colon cancer cells. This is also established in multiple number of studies. High fiber diet reduces the possibility of colon cancer. Low fatty diet in low red meat. So anti-cancer foods, turmeric has been named as a superfood because of the same reason. Next slide, please. So vitamin D, there are multiple cancers that may be caused because of, escalated because of vitamin D deficiency. Vitamin D and calcium deficiency is very typical in vegetarians of India, and vitamin B12 as well. Vitamin D specifically taken in good supplements, taken in the form of natural sunlight. If people are exposed to the natural sunlight in the mornings, are very, very good. And a simple going out for early morning walk can prevent cancer. What is better than that? Next slide, please. Curcumin can slow the cancer growth. Next slide, please. So this slide, I will just let you know all. Till now, we were talking about the prevention of cancer. How can we detect cancer early? And how can we prevent cancer in us in the future or coming future? Us or our people. In the cancer treatment, the standard treatment known to everybody here is a surgery, chemotherapy, and radiation therapy. I'm sure of it. Multiple treatments are available which are targeted to specific types of cancers in the form of hormone therapy, in the form of targeted therapy and in the form of immunotherapy. So now the cancer treatment has escalated and become a personalized and precision treatment. It is called a personalized medicine because all this treatment are given specifically to specific needed people who are having specific type of cancer, in which we know for sure this particular treatment is going to work because the cancer cell is having the target where the chemical or the treatment will go and directly attack. So the types of treatment are elaborated as I mentioned. Next slide, please. Already mentioned, early detection is the key. So all the women who have not got a mammogram done, please go and get a mammogram done. All the males who have not got a PSA done and you are above the age of 50 years, please go and get a PSA done. For women, a pap smear, a simple normal per vaginal test like an earbud, we take a scrape from the cervix. A pap smear to be done, and all the people who are elderly age, above the age of 60, are naturally, because of the diet and everything, are having our diagnosed with more number of colorectal cancers. So one colonoscopy, at least as mentioned by Dr. Shiva, should be done on everybody. Now these tests are not much costlier. Cost is already mentioned, but that can actually save your life. Something which is zero cost is your self oral examination every monthly and self breast examination for females. These will also lead to an early detection, and that is the key to save yourselves. Next slide, please. So as I mentioned already, my third take-home message was cancer never kills. Remember, cancer is not a stigma. If you have cancer, you will never die. You will die only because that cancer is becoming diagnosed at a later stage. In early stages, in stage 1, most of the cancers are 100% curable. Up to stage 3 also, up to 81% is the survival rates in most of the cancers. But when the disease is diagnosed in stage later 3 and 4, survival rate reduces to 26%. You can see in the slide clearly mentioned. Please remember, cancer never kills, only late detection kills. That is why we can all be saved from cancer by an early diagnosis and a good early treatment by a specialist. Do not waste your time going to multiple other broad specialties and asking for the diagnosis where the diagnosis is delayed despite of going to the doctor. Rather, go to an oncologist who knows the disease by clinical examination, doing simple tests, sometimes not even doing the test. They can tell you it is not cancer or it is cancer and treat them accordingly. Next slide, please. Same thing is repeated here. You can see in prostate cancer, ovarian cancer, breast cancer, and lung cancer. So the green is your survival in 5 years' time. The white is the chances of death. So in the cancers in stage 1 and stage 4, the chance of survival is for all the types of cancer more than 50%. Except lung cancer, all the other have 90% or more chance of survival in 5 years' time. And in the later diagnosis, the survival chances reduces up to 4%. Next slide, please. The same thing, when the stage of the disease increases, we have to use more and more types of treatment to the patient. And the cost of treatment also increases drastically. So when a patient is, when everybody who are working, busy in the lifestyles, are ignoring their own symptoms, not going to the doctor in time, they are actually delaying the diagnosis. Because of the delay in the diagnosis, the stage of the disease is getting upstaged, going to stage 3, 4, where the cost of treatment is going to escalate. Very, very nicely portrayed in this. And the survival rate decreases. So what is the point? Something that we can do in an early stage, treat them, make them survive. We can live. We should not ignore the symptoms and signs which we are coming across. Next slide, please. So just as one size does not fit all, cancer treatment is decided based on multiple factors: stage, comorbidities, fitness of the patient, type of cancer, a person's body immune mechanism. Everything leads to the specific cancer treatment. As I mentioned, the world is going towards precision oncology, and personalized medicine. We have to understand that. Next slide, please. Yeah, so thank you so much, Easy Treatment and the organizing committee. It was wonderful talking. It was a very exhaustive session. Now, the number of slides were more, but I hope all of you can at least take these four take-home messages. I will repeat all the 4 messages. Number 1, plead to all the younger generations: be smart, do not start. So tobacco, alcohol, the unhealthy lifestyles that we do that is under our control has to be prevented. We have to make our younger generation smart is number 1. Number 2, as I mentioned, cancer does not kill. The late diagnosis kills. So do not ignore the signs and symptoms that Dr. Shiva mentioned here. Please remember that you have to go to the correct doctor, and as soon as you feel something, so that if there is also a disease, it will be diagnosed early and treated very early. Number 3, do a self-breast examination and oral examination, all of you, every month. The details can be provided by me. I am associate professor and consultant surgical oncologist at Bhubaneswar IMS and some 2 hospital. You can connect me through Easy Treatment anytime. I will be available for any kind of help if required. But do these self-tests yourselves. Number 4, please do 1 mammogram for all the females, 1 PSA for all the males. After this session, number of people who are booking through Easy Treatment or through anywhere, please get this done and save yourselves. That is actually going to save the community. And in the 4th prevention part, I definitely already mentioned about the cervical cancer vaccination to be done. All the younger females deserve to be vaccinated. Similar way, why they are vaccinated for polio, and we could eradicate polio from India. Thank you so much. Now we will go with the question answer session. A lot of questions are popping up in between. I think anybody who has any question can ask us, please. Dr. Shiva is also available for the question. Thank you so much, Bala.
Thank you so much, ma'am. I think very well put across. I think the very important thing to understand from this discussion, the early detection is the key. And if there's any specific questions, are there any? If you have any queries, you could just ask in the chat box or also ask directly to us.
So, Mr. Atulya Rath, I think you have raised the hand. Ms. Hema, even you have raised the hand. Mr. Atulya Rath, you can take the question first. Kindly unmute yourself. Sir, you are on mute, sir. Kindly unmute. Mr. Atulya, kindly unmute.
Yeah. Good afternoon, madam.
Yes.
Madam, can you tell me the difference? Suppose a patient is in stage 2 specifically, a lung cancer patient. A chemo is required first, a radiation is required first. What is the basic difference between the two? Because usually some doctors are telling chemo is required, some is telling no, chemo is not required, radiation can be given.
So, sir, let me tell you 2 things. As I already mentioned, if you would have understood that.
Yeah, madam, I have joined a bit late. I'm extremely sorry for that.
Okay, sir. So, not a problem. So, sir, I'll tell you, lung cancer specifically, when you're talking about, lung itself has very many varieties of cancer, like squamous cell cancer, adenocarcinoma, and other varieties. Even neuroendocrine tumors are there. Different types of cancers have different treatment protocols. When you are protocols means in some particular, like in adenocarcinoma, chemo should be given, then only the patient will have a good chances of survival. Whereas in squamous cell carcinoma or other varieties, chemo may not help also. Having said that, I would like to mention most important thing here is, sir, when you're talking about a stage 2 disease, means the stage of the disease is limited to the lung only, and the disease is smaller in size. When you're talking about stage 3 disease, it has gone to the other lung or in the larger areas, where the chances of survival will be delayed or later. So whenever the disease is focused and in one particular area, a radiation along with chemo or radiation followed by chemo or only radiation will also help. In early lung cancers, like stage 1 and 2, surgery helps the best because I operate, I remove that particular part of lung as a segment and remove the complete part, followed by chemotherapy to the patient so that the patient's recurrence of the cancer chances reduces. So whenever the disease is in early stage, we can remove the cancer completely from the body. Wherever in advanced stages, usually we cannot remove and a local treatment won't help. So systemic treatment in the form of chemotherapy is required. In lung cancer, so specific types of cancer, only radiation also helps, along with a couple of cycles of chemo, if required, can be added later on.
And you recommend for stage 2 patient surgery can also be done?
Definitely, sir, but that will depend upon the type of cancer, number one. Number two, what are the mutations present in the patient? Number three, what is the exact extent of disease? Only then the kind of surgery or the kind of local therapy treatment can be decided.
Madam, this lung cancer patients, only these cardiac thoracic surgeons will be doing the surgery?
No, sir. So there is a team. As I told you, it is the world is going towards a different approach now. It is a precision. So specific patient lung cancer, I am a cancer surgeon. I operate for lung cancer. If required, the cardiac team is also there. So it is in a collaborative effort of two teams completely. Then the outcomes are usually the best. And usually in multi-specialty hospitals like IMS and some, where I am working right now, at Yashoda Hospital also, the complete teams are available to give the patient the best treatment possible.
Okay, madam. Thank you very much. I am there in the same. I am working also in a hospital in the marketing department. I am near to Som Hospital. I'll come and visit you.
Definitely, Mr. Atulya.
Thank you, madam. Thank you.
So,
Mr. Prakash.
Yeah, okay. Sir. No problem. Go ahead. Mr. Prakash, can you just ask your question?
Yeah, I just wanted to know if continuous chewing of betel nut or betel leaf cause cancer. And there are 2-3 related questions. Can hot and spicy food cause cancer? Barbecued food cause cancer? Just general question.
Okay. Yes, sir. So,
okay, you can take.
You can take. Sir, you can take.
So Prakash sir, like it's a very good question. Number one, yes, long-term betel nut, betel quid, and betel leaf are all risk factors for cancer. What it does is basically causes certain changes in your oral cavity, which might actually become cancerous over the period of time. So these changes, especially like these changes are called as pre-malignant changes. So these might actually go on to become cancerous in the future. So usually these kind of precancerous lesions are usually irreversible, and in most of the instances they do not turn out to be cancer. But yes, there is if you continue to go on to chew tobacco or betel nut, then I think the probability of this becoming cancerous becomes very high, and hence I think the need for regular oral examination is required in these kind of cases. And as far as hot and spicy, there is no data to say that the hot and spicy foods can cause cancers. In that case, I think that you might see. So again, lastly, coming to the there are certain kind of risk factors such as smoked fish, wherein you have increased incidence of nasopharyngeal cancers, which is known to be a very high risk, wherein the fish is prepared in a manner where which increases the probability of occurrence of nasopharyngeal cancer. I guess I have answered your query.
Thank you so much, Dr. Shiva. Mr. Prakash, I would like to interrupt you here and add one more point to what Dr. Shiva told right now. Anything that you are chronically, repeatedly inducing to the body and is increasing inflammation in the body will have a chance in a long term to lead to a pre-malignant condition, which is a precancerous condition, which will eventually become cancerous. So all the things that you mentioned, like betel nut, like spicy food, hot food, like barbecued food, are local irritants to the mucosa of the buccal, oral cavity, also to the food pipe and stomach. As Dr. Shiva already mentioned, there is no direct relation to hot and spicy food, which is being mentioned in any of the studies, but there is direct correlation of plain betel nut, pan ka patta, plain betel nut chewing leading to cancer in long term. There are multiple number of studies in Japan, because Japanese people have a lot of charcoal, grilled and smoked food to harbor stomach cancers. And so, as sir already mentioned, smoked fish leads to nasopharyngeal cancer. So there is a direct correlation of any kind of chronic irritation to any part of your body that will lead to a chronic inflammation of that particular part. Where there is chronic inflammation, there will be a chance of having cancer.
Thank you, madam. Thank you.
Yes, Mrs. Hima. Yeah, please ask. Go ahead with your question, Miss Hima. I think you need to unmute Hima.
I think, sir, she has raised her hand in the beginning of the session. She's not there. Miss Hima,
Yes.
are you there? Anybody else? Next person can take the ask the question. Shiva sir is there. Anybody else who wants to ask any question? Please feel free to ask any kind of question, whatever query comes to your mind. We have tried to give you a basic idea of what all could cause cancer and how we can prevent it.
So in the interest of time, I think we cannot go into specific. I think if you have any specific question with regards to each cancer, because cancer is not just a one disease as many people perceive it as. So many people often ask me whether it's a single disease, So it's not like that. It's a cancer is you have different varieties of cancers which behave. Each cancer is different for a subject, and each cancer, again, within the cancer itself, you have a different varieties of the single site-specific cancers also. So the treatment has to be personalized and it cannot be generalized, but like most of the people misunderstand it. So I think if you have any specific pertinent cancer you need to know, you can always reach out to us, either Dr. Garima or Dr. Shiva Prasad, myself, in Hyderabad or in Odisha. We would be happy to resolve all your queries.
Absolutely, sir. Absolutely. I think Datta has raised the hand. Datta, you can take the question.
Yeah, thank you, Garima and Shiva, Dr. Shiva. So it's a very informative session. So am I clear?
Yeah, you're absolutely
Yeah,
right. Please go ahead.
So actually, I am 24 now, and I'm not habituated to any alcohol or tobacco. So as usual, for a normal health checkup to get reduce of cancer at my younger age, what are the tests we need to take? Like I saw prostate and breast checking for women and cervical and all. So for my age, what will you suggest?
So for your age, Mr. Datta, the first number one, there are two things. Like I said, that for the prevention sake, the madam has just mentioned about HPV vaccine. It is not just protecting against one particular cancer called cervical cancer. It's also protective against also cancers like anal cancers, which is again the lower part of your intestine, the colon, the lower end of the colon, and also cancers like oropharyngeal cancers, I think. And it is also recommended for all males as well as females. So number one, I think that will definitely help you in reducing the chance of occurrence of these cancers. And second, I think as far as the screening, your question, the first question, the screening for your age is not actually recommended unless you have any kind of family history of cancers at your point. Usually the prostate cancers we recommend only if you are 50 and above, and it's not at your age, 24 right now. Unless you have any pertinent, definitely at your age, I wouldn't say that there's a 0% chance of cancer occurrence, but those cancers which tend to happen at your age, they are usually, they do not really benefit much from screening at that particular time. So it's only that the screening has proven to be effective only in few selective cancers which has actually reduced the chance of death from those cancers. So yeah, I hope you got my answer.
Yes, yes. But one more question. Like nowadays, we are having all the food which is more pesticide applied and all. So we think like we will also get cancer in the
Yes.
future because it's very common. It's became very common. So what do you suggest?
So
We need to feel in that way, or we need not to?
yeah. Yes, sir. So it's a good question. Again, there are lots and lots of studies which are happening. Again, there is no direct, implication of one particular this thing. What you can do is as you said, there might be many carcinogens what we are eating. Definitely, that's the reason you have people asking you to go organic and everything. But yes, I think what you need to do is try to be as organic as possible. Develop healthy lifestyle, like reducing the chance of obesity, and also I think you need to take food which is rich in antioxidants, and taking vaccinations, start screening at the early age, so it's the right time. And I think these are the things which we can do in our control. But I think those things, with regards to the food and everything, I think it's very hard to actually give up on all these things, because we do not know as in which particular food has which, because it's a very even when you're getting all the food and everything, what kind of carcinogens are present is hard to detect, because we do not have a regulatory authority, and we do not have studies actually confirming the presence of carcinogens. So it's quite difficult at this point. But definitely you can go a organic way, in that will help a long way. But you do not have a evidence to go, like totally go for only just organic and not take other things. Yeah.
And so, as correctly mentioned by Dr. Shiva also, most of the people here most of the people throughout are either very scared that they may have cancer. So just live a normal life. That's okay. All the things that you are eating or everybody is eating may cause cancer, right? As we told, there are multiple things. What we have to do is choose being healthy. Eat a lot of fresh fruits and vegetables. Get yourself vaccinated with HPV earlier. Be careful of any symptom that comes. Even if you're careful enough to come to a specialist earlier, you will be cured. You need not be scared of anything. Yes, I think there are two more hands. Ms. Karishma and Mr. Jayesh. Anybody could go ahead with the next question. Ms. Karishma, are you there?
Yes, ma'am.
Yes.
I have one personal question, ma'am. Actually, I want to know, is cancer is genetic? And if it is yes also, then what percentage of cancers are caused by genetic factors?
So definitely, Dr. Shiva already, sir. So you would like to
Yes.
take
Yeah, sure. So I think a very good question. Actually, there are certain cancers which are definitely inherited from genetically. I think especially the ones like breast cancers, ovarian cancers, colon cancers. I think so. Again, unless you have a strong family history, you have a genetic. What we generally do is, especially with this kind of
I think, sir,
yes, ma'am.
you were not audible, sir. Could you repeat the last statement because they have not heard it?
Yes, yes. So if whenever we have patients coming with a family history of breast cancers or ovarian cancers or colon cancers, we generally refer them to genetic specialists in our department, in our hospital, and to get themselves evaluated for common hereditary syndromes, and proceed accordingly if they are diagnosed. So about, if you're asking me about the percentage, about it would be accounting for less than 5% of the cases in case of breast cancers, and most of the cancers are actually sporadic. They are not genetic, but there are certain cancers which definitely have the genetic predisposition, such as the ones I just mentioned. Ma'am, if you'd like to add anything to this, please go ahead. Ma'am.
Yes. So, sir clearly mentioned only 5 to 10% of all the cancers are genetic. If you have a strong family history, kindly visit an oncologist, a cancer specialist, be it a surgical oncologist like me, be it a radiation oncologist like Shiva sir, or clinical oncologist like Shiva sir, or a medical oncologist, because they will tell you the best screening protocol in which screening has to be done to prevent that genetic disease or to detect it earlier. Mr. Jayesh, next question you can take, please. Mr. Jayesh, are you there? You have raised your hand long back. I think Mr. Jayesh, we are not able to get to you. Next question by Varsha. Miss Varsha, are you there? Shiva sir will
Yes,
take the
ma'am.
question. Yeah, please tell your question.
Yeah, Basha,
Ma'am,
go ahead, please.
actually, I want to ask Dr. Garima, please, ma'am.
Okay.
Yeah, so please go ahead.
Ma'am, can you please answer? Hello.
Yeah, Varsha, tell the question, please.
Yes, ma'am. Ma'am, knowing about the family inheritance, my mother had breast carcinoma. She was stage 2. We had done the test like triple negative, but about BRCA we don't know. So how much risk is there for her children? If
Yes.
my paternal side, there is no risk. Nobody had in 2 generations. In maternal side, my grandmother they don't have. But my mother, I think maybe P53 mutation or something like that, because BRCA history we don't know. Ma'am,
Yes.
what is important? What will be better for screening for her children?
Yes. So, Varsha, two things. One, as Dr. Shiva already mentioned, breast cancer, 5% of total cancers are attributable to the major carcinogens, or the major mutations which are identifiable easily. 5% only. As you do not have any family history of any other person in the maternal side of cancer, an isolated first diagnosed case was your mother, she could still have a BRCA mutation, which is not known to you. So the best thing to do is to get your mother's, we call it a germline mutation for BRCA to be done from your mother's blood test, so that first you understand whether in your mother it was a disease because of mutation or not. Also, the other kind of BRCA mutation that is checked is from the tumor tissue itself. That is called a sporadic mutation, as Sir told. So if you are diagnosing a BRCA 1 or 2 in the tumor cells or blood of your mother, only then it becomes a positive history of family for BRCA mutation. And then there is a specific recommendation that the 10 years younger or earliest at 40 years, you should have 1 mammogram done. Having said that, one more important thing for you to remember is there are multiple small genes. As you mentioned about P53, you know something about the disease, of course. So there are multiple other mutations of unknown significance and multiple mutations which are smaller mutations like CHEK2 mutations, ATM mutations, PALB2 mutation in females, which leads to cumulative effect to cause breast cancer. So when a female has a triple negative disease at an early age, usually diagnosis is done, ideally the recommendation is to send the tumor block for a complete at least 28 gene panel for mutations, so that we can understand what are the possible mutations that the children may harbor. Thank you, Varsha. I think I made myself clear.
Yes, ma'am. Thank you, ma'am.
Mr. Jayesh, you are still with raised hands. If you are there, you can ask a question. Mr. Datta, you have one more
Excuse
question.
me, ma'am.
Yes.
Ma'am, can I have another question?
Yes, please, not a problem at all.
Ma'am, does we inherit from our paternal side?
Of course, of course. So you already know so much. You also know that 2 genes that we are basically born of, one comes from the maternal and one comes from the paternal side. So all the genes that is there in the maternal and paternal things will have an effect in the human body. So we can inherit from both our parents.
Ma'am, environment is a major factor for long-term stress
Yes.
and sleeplessness.
So Dr. Shiva very clearly mentioned that 95% of all the cancers are sporadic. Sporadic means because of all these factors which is preventable or we have acquired during our lifetime, which is not come in gene from our parent. Like,
Ma'am, if it is been sporadic, then we can maintain it healthy by lifestyle and environment and food.
yes, absolutely. That is what we are talking about.
It's not more risk of inheriting from her.
Pardon?
If it is miss, I think it is been more sporadic type, then it will be safer for us if we maintain a good healthy lifestyle and all.
Absolutely.
And the risk of inheritance is lesser in case of sporadic.
No. See, so you are getting confused here. All the types of cancers, if you are taking 100 patients of people who have cancer, out of that 100, when we have checked genetically and everything, we have found that 5 to 10% is only attributable to genetic factors. But all the people who have genetic inheritance also are also exposed to all the sporadic parts, right? So all the causes that we discussed today are already there in the people. So what we can prevent is what we mentioned today. There are multiple other factors that can cause cancer in a person. So there are so many patients who do not smoke, do not consume alcohol or tobacco, but they are cancer patients, correct? That means not everything is attributable directly to something. A person having absolutely healthy lifestyle, leading absolutely normal, good life, very healthy, balanced lifestyle, may also have a cancer. So what we are trying to tell you here is, when there is a genetic disease, so in specific kinds of cancer, only after checking the genetic mutation, we understand it is this genetic disease, like BRCA mutation typically. In those cases, there are protocols in which in the subsequent generations, we can test and detect it earlier so that we can save the people. Whereas in sporadic causes, we cannot save the people by doing something earlier apart from changing the lifestyle. That's it.
Yes, ma'am. If someone is having the mutation in the gene due to environment and other causes, which is causing a sporadic one, that doesn't mean her children will have the sporadic issue.
So that is what I'm telling. Amongst them, a multiple number of genes are such that first, I am the first generation. Supposedly, I have a mutation in my gene. This gene, mutated gene, can go to my next generation also. In those,
Okay, ma'am.
the
I
specific,
understood, ma'am.
yeah, it may go or may not go. Sometimes
Yes,
they are so insignificant that even if they go, they will not cause cancer in my offspring. Sometimes they are significant.
This thing I can detect from my mother's blood and testing the gene.
Yes, blood and
What you
also the
said
tumor
before.
cells. Also the tumor cells. So that is why I mentioned about
Already that
the gene
mastectomy, that
panel done.
specimen already tested, ma'am. It's not a present.
Tested. The specimen is tested for BRCA already.
Ma'am, that report I am not sure. I am not getting whether it is positive or not. Now we can
So
do the
Varsha, where
BRCA
do you
status
stay?
from the ma'am Bhubaneswar only.
Bhubaneswar. So you could get all the reports and come once to IMS in some and meet
Yes,
me
ma'am.
with the reports, so that will not disturb everybody present here and not elongate
Okay,
the
thank you, ma'am.
webinar.
Thank you, ma'am. Okay,
I am
I
at
understand.
IMS in some every day, to Full Nakra, and at some ultimate. You can call me up and come. My number and my email ID, everything is available with EasyTreatment also.
Okay, ma'am.
You can
Thank you,
get
ma'am.
it. Not a problem at all. Mr. Jayesh?
Jayesh, yeah.
Sir, I think Mr. Jayesh has raised his hand. He is not able to ask questions. Mr. Datta had one more question for you. Mr. Datta, if you want to ask a second question, and also Mr. Prakash, you can ask yourself. We will conclude the session in another 5 minutes from now, I think.
Yeah, thank you, Dr. Garima. So actually, as a text in the chat box, so my mother got previously paralysis, so brain tumor, and now it's cured. But any chances of getting any cancer related to that, or if yes, what precautions, or if not, it's fine. I need
So
this
basically,
contact. Yeah.
Yeah, Mr. Datta, I think in you mean to say that your mother was having was detected with paralysis a few times. So how long was this after the detection of cancer?
Not. It's a brain tumor. It's been almost 3 to 4 years before, but
So she
it's
had
got
brain
cured.
tumor.
Yeah. Paralysis. Actually,
So one thing, so definitely see. Yeah, so the paralysis definitely, if there is any lesion in your brain, definitely it could lead to some kind of paralysis. It depends on the where the location of the tumor is in your brain. But however, I think we need to look at the scans and to know whether that it is actually the tumor or if it is something else. So definitely there is a chance of recurrence of brain tumor, especially if there are tumors like glioma. There are so many tumors in the brain which can happen, or it could also be secondaries in your brain, like tumors from other sides, which can actually spread to the brain. So those kind of tumors we need to first we get evaluated by imaging, by scans like MRI brain, and then if there is no other site of disease except for your brain, then we'll have to do a biopsy to rule out the to understand whether it is arising from brain or whether it is arising from elsewhere, and also to rule out any kind of brain stroke causes also. So there are multiple possibilities. I think we need to examine the patients. We need to do certain investigations, imaging, and then we'll be able to tell you whether it could. Yes, if you're asking the question that whether the tumor could have led to a paralysis, definitely yes. But we need to look at the scans or what has actually happened, whether it is looking like a tumor, metastatic deposits, or whether it is because of the primary brain tumor. So so definitely yes, it can be one of the causes.
Thank you, Dr. Shiva.
Yeah. Yeah, Mr. Prakash, I think.
Yeah.
Please go ahead.
This is my last question. It's a general question, but is there any study done linking microwave cooking to cancer?
Dr. Garima, you can take the question.
Yes, Mr. Prakash. So I will not mention exactly the number of studies that are done. The study that I am aware of, there are 3 studies, one in US, one I think was done in Germany and another country together. So they had done on the various kinds of coating that is done for the cookwares, like a Teflon coating or aluminum cookwares. So what was found in the study is very interesting. The aluminum cookwares, which usually gradually releases aluminum particles and ions in the food as well, leads to or increased aluminum toxicity in the body. Out of that toxicity, what is the percentage of cancer is not mentioned in the study. Whereas the other kinds of coatings like Teflon and the black CPCs, for those there is no direct correlation that is mentioned, but the study has directly mentioned that it increases the chronic inflammation if used for a period of more than 10 years in the same household. So this is a very interesting finding that was mentioned. And as I already mentioned you, the basis of carcinogenesis is the chronic subdued inflammation in the body. So definitely maybe in sooner future, we will have definite studies which are mentioning the direct correlation from everything. But aluminum toxicity has been established. A Teflon toxicity of the carbon components have been established. Direct correlation is not established. Whereas the microwaves that are going to the food has also been shown to cause increased subdued inflammation in the body. There was one interesting study from Japan. I think in 2022 it was published. That study had shown that chronic usage of microwave in a household, if used above a temperature of 200 degrees for a duration of 6 consecutive hours per person, as mentioning the study article, may increase the chance of cancer of stomach. The Japanese people do more studies on stomach cancer, so probably that incited them. So there are these 3 studies that I am aware of. Maybe more have come. We could let you know later on if you can mail us or ask us. Thank you so
Thank you,
much.
madam. Thank
So I think none of the other people have any more questions. Karishma, you can take over. From my side, I thank EasyTreatment and the organizers for giving me this opportunity to connect with so many patient listeners. It has been almost 2 hours now. Thank you so much for being there and listening to us. And I hope the messages were very clear and some betterment of our own lifestyles, everybody present here, can start from today. Thank you.
Thank you, Dr. Garima. Thank you, Dr. Shiva Prasad. And one more thing, actually, we need to close the webinar. So anyone, if you want to ask any question, you can just contact us on the same number. Our dedicated team will always there to help you. And we have some special offers also for our webinar attendees. You can just get 50% off on doctor consultations and 20% off on screening tests. The doctor will be available at their respective hospitals. Please don't hesitate to call us or WhatsApp us also. The same number, I'm repeating the number, 900-000-1766 for your appointments or any additional help, any advice, any treatment recommendations about cancer or any other disease also. We are here to help you. Thanks again to all the participants who have joined today. Thank you.